Hello and welcome to this part of your combined cupping course. In this part we're going to be looking into hijama. So hijama is application of cups onto the skin, where we will be using a lancet device, or we're going to be using a blade, surgical number 15, which is sterile, in order to just scrape on top of the skin and let it withdraw blood using the help of a vacuum pump. So in this section we're going to be using Chinese plastic cups. There are different manufacturers now. You also get Turkish plastic cups as well, but generally the Chinese plastic cups has been in the market for a very long time, for several decades. These Chinese plastic vacuum pumps make your work much easier and safer than with glass cups. Now, when it comes to hijama, because of the fact that blood is involved, we do not use the cups on anyone else. It is only for one-time use per client, and then it's disposed of safely as clinical waste using a clinical waste collection. So it cannot be thrown away in sort of like residential bins. So you need to make sure that they're disposed of correctly, to ensure that safety precautions are put in place. Okay, so plastic cups, vacuum pumps makes your work much easier. Okay, in this occasion they come with a special plastic suction gun, a vacuum pump, which we will demonstrate to you on the practical element of the course, and the gun actually sucks the air from inside the cup and allows the cup to attach to the skin easily. So in addition, a tube is usually provided in the set, allowing you to work more conveniently or cup yourself if needed as well. But when it comes to hijama, it is better to be done by a hijama practitioner. Another advantage of plastic vacuum cups is that you actually control the vacuum level. So depending on how many pumps you do, depending on the sensitivity of the client's skin, you can put a few pumps or less pumps, and just make sure that it is just tight enough just to withdraw the blood. And it is especially important for sensitive or delicate patients, because you can only apply the suction quite gradually. Take the cup from the box, and then you can attach it. Brand new cups which hasn't been used, please ensure that they have been stored safely for health and safety aspects. Okay, and then you can apply it. Now, what are the mechanisms of hijama? So how does it help? Now, hijama cupping obviously is going to be quite a short clip in this video. We do have hijama course which looks into the point system, where the point system is more for illnesses, and there is a course on that, and it goes in full detail with all the different illnesses that you can do hijama cupping for. And then you have the other one, which is simply derived from the hadith of the Prophet sallallahu alaihi wasallam, Muhammad sallallahu alaihi wasallam, and then you could use cupping according to how it's done before the point system was implemented. So it is good to know both methods. I would say the implementation of the sunnah method is more to do with where there's muscular pain, whereas the point system is more to help with certain illnesses, and it is mostly used for medical reasons. Okay, so but in the sports industry, people do use it for muscular pain mostly, and where there are issues. Okay, so there are two different methodologies from our understanding, and I believe that both methodologies can be used in order to treat the client. And also, how does it work? So cupping dilates topical capillaries and increases dermal blood flow, which has been proved by numerous studies. Okay, and then blood vessels in the treated areas by cupping are dilated by release of vasodilators, and then which leads to the increased blood circulation. Suction from cupping draws fluid into the treated area. This suction forces expands and breaks open tiny blood vessels. capillaries, in other sense, under the skin. Your body treats the cupping area like an injury. It sends more blood to the area to stimulate the natural healing process. And then after hijama session, it is increased blood flow with skin, muscle and other soft tissues being pulled into the cup. Due to suction, this will naturally increase blood circulation to the area being treated. The increased flow will flush out any stagnated toxins in the blood, as well as attract immune cells to the treated area. Okay, so this is pretty much what hijama does, and I hope that this will be beneficial to your clients. And you have to make sure you use all safety protocols, and you will need to use a separate consultation form which goes much more in detail. Now, this course is a combined course. It is best for students to do it after they have done the main courses. So please do the main hijama courses, where it will go much in detail, and then you can see how it can be done as a combined treatment for people who might need it for muscle problems, as well as relaxation, and using a combined treatment of all cupping therapies applied together, where they would probably want to have a full treatment plan. So you have to kind of treat each different cupping modalities for what they can offer. So dry cupping more for muscular issues, fire cupping more for relaxation, and you have the hijama to remove toxins. So all of these are beneficial, and it will help to enhance the health of your client, ensuring that they take the right vitamins and supplements after. So vitamin B6, B9, B12, which is found mostly in leafy greens. Eat more sort of lean meat, so chicken, fish, salad after the treatment. Also, if they're diabetic, do not have a shower for 24 hours, and then after that they can. And for people who are not suffering from diabetes, they can have it, ensuring that they take Epsom salt, and also kind of dilute their bodies with Dettol in order to help with more circulation and kill off any bacteria and germs. So please do follow the protocols that we are setting up, so it doesn't have any issues with your client. If they feel itchy on the skin, then they might apply some natural honey, which is very antiseptic in that sense, and it has healing properties in it. Plus they can also use sort of like natural organic olive oil to moisturize the skin as well. So yes, you will learn more on the other courses that we provide in hijama itself, but this is a quick snapshot of the treatment itself, and we hope that you find it useful and you can apply it safely within your practice. Okay, so